What if something silently growing inside the body could change everything? Without warning, without pain, and without permission. This is the reality of breast cancer, a condition that affects millions yet is often misunderstood until it's too late. Breast cancer is not just a disease, it is a complex biological battle happening deep within the human body. It begins when cells in the breast start to grow uncontrollably, forming a mass that can invade surrounding tissues. In this 3D health exploration, the focus is on understanding how these abnormal cells develop, spread, and impact vital systems. From early detection to advanced treatment methods like surgery, chemotherapy, and targeted therapy, every stage reveals how science is fighting back. Awareness, timely diagnosis, and modern medical innovation together create a powerful defense against this life-threatening condition. Early detection plays a crucial role in understanding and controlling breast cancer before it progresses into advanced stages. At the biological level, cancerous changes begin when normal cells in the breast tissue undergo genetic mutations, causing them to multiply abnormally. In the early phase, these changes may remain silent, without noticeable pain or visible symptoms, which makes awareness of subtle signs extremely important. Small lumps, changes in breast shape, skin dimpling, or unusual discharge can sometimes indicate early abnormalities that need immediate attention. Modern diagnostic tools such as mammography, ultrasound, and MRI help in identifying these changes even before they become physically apparent. These technologies allow medical professionals to visualize internal structures in high detail, making it possible to detect tumors at a very small size when treatment is most effective. Regular screening increases the chances of identifying cancer in its initial stages, significantly improving survival outcomes and reducing the need for aggressive treatments later. Self-examination also plays an important role, as it helps individuals become familiar with their normal breast structure and notice any unusual changes early. Hormonal factors, genetic mutations like BRCA1 and BRCA2, and lifestyle influences can increase risk, making routine checks even more essential for high-risk individuals. Early detection is not just a medical process but a continuous awareness practice that combines observation, technology, and timely action to stop the progression of abnormal cell growth before it spreads into surrounding tissues or lymph nodes. Tumor development in breast cancer begins at the cellular level when normal breast cells experience genetic damage that disrupts their natural growth cycle. Instead of following the body's controlled process of division and death, these altered cells start multiplying without regulation, forming a cluster known as a tumor. In the early stage, this growth may remain localized within the milk ducts or lobules, but as the mutation progresses, the cells gain the ability to invade surrounding tissues. This transformation is driven by changes in DNA that affect key regulatory genes responsible for cell repair and apoptosis. As the abnormal cells continue to divide, they create a mass that can vary in size and density, often remaining undetected in the initial phase due to its microscopic nature. Over time, the tumor may recruit blood vessels to supply nutrients through a process called angiogenesis, allowing it to grow more rapidly and sustain itself within the breast environment. The surrounding healthy tissue becomes compressed and damaged as the tumor expands, altering the natural structure of the breast. Hormonal influences such as estrogen and progesterone can also play a role in accelerating the growth of certain types of breast tumors by stimulating receptor-positive cancer cells. Genetic predisposition, environmental exposure, and cellular instability all contribute to the speed and aggressiveness of tumor formation. As the tumor evolves, it may acquire the ability to detach and spread through lymphatic channels or bloodstream, marking the transition from a localized condition to a more advanced stage of disease progression. Risk factors associated with breast cancer arise from a combination of genetic, hormonal, environmental, and lifestyle influences that collectively affect how cells behave within breast tissue over time. One of the most significant contributors is genetic mutation, particularly inherited changes in genes such as BRCA1 and BRCA2, which normally function to repair damaged DNA and maintain cellular stability. When these genes are altered, the risk of uncontrolled cell growth increases substantially. Hormonal exposure also plays a major role, especially prolonged exposure to estrogen and progesterone, which can stimulate the growth of certain breast cells and increase the likelihood of abnormal transformations. Factors such as early menstruation, late menopause, or hormone replacement therapy can extend hormonal influence over a longer period, raising susceptibility. Age is another critical factor, as the probability of cellular mutations accumulates over time, making older individuals more vulnerable to malignant changes. Lifestyle choices also contribute significantly, including high-fat diets, lack of physical activity, obesity, and alcohol consumption, all of which can create internal conditions that favor cancer development by affecting hormone levels and immune response. Environmental exposure to radiation or certain chemicals may also damage cellular DNA, initiating the first step toward tumor formation. Reproductive history, such as not having children or having the first pregnancy at a later age, can slightly increase risk due to prolonged uninterrupted hormonal cycles. Additionally, chronic stress and weakened immune function may reduce the body's ability to identify and eliminate abnormal cells efficiently. Even though these factors do not guarantee the development of breast cancer, they increase the probability by creating a biological environment where normal cell regulation becomes unstable. Understanding these interconnected risks helps in recognizing how internal and external influences interact at the cellular level, shaping the overall vulnerability of breast tissue to abnormal growth patterns and long-term transformation processes. Treatment options for breast cancer are designed based on the stage of the disease, the biological characteristics of the tumor, and how far the abnormal cells have progressed within the body. The main goal of treatment is to remove, destroy, or control cancerous cells while preserving as much healthy tissue as possible. Surgery is often one of the primary approaches, where the tumor is physically removed from the breast. In some cases, only the affected part is removed, while in more advanced situations, a full removal of breast tissue may be required to prevent further spread. After surgery, additional treatments are commonly used to target any remaining cancer cells that may not be visible but still exist at a microscopic level. Chemotherapy uses powerful drugs that circulate through the bloodstream, attacking rapidly dividing cells throughout the body, which helps in reducing tumor size and preventing recurrence. However, because it affects both cancerous and healthy rapidly dividing cells, it can also lead to side effects such as fatigue, hair loss, and weakened immunity. Radiation therapy uses high-energy rays to destroy cancer cells in a specific area, often applied after surgery to eliminate residual abnormal cells and reduce the risk of regrowth in the same region. Targeted therapy focuses on specific molecular changes in cancer cells, attacking only the abnormal pathways responsible for growth, which makes it more precise compared to traditional chemotherapy. Hormone therapy is used when cancer cells are sensitive to hormones like estrogen, and it works by blocking or lowering hormone levels to slow or stop tumor development. In recent advancements, immunotherapy has also emerged, helping the body's immune system recognize and attack cancer cells more effectively. Treatment planning often involves a combination of these methods to increase effectiveness and improve survival outcomes, with continuous monitoring to adjust strategies based on how the cancer responds over time and how the body adapts to ongoing medical intervention. Prevention awareness in breast cancer focuses on understanding how daily habits, biological factors, and early behavioral choices influence the long-term health of breast tissue and its resistance to abnormal cellular changes. At the cellular level, prevention is linked to reducing the conditions that allow DNA damage and uncontrolled cell division to begin, which often develops silently over time through repeated exposure to risk-enhancing environments. One of the key aspects of prevention is maintaining hormonal balance, since prolonged exposure to estrogen and progesterone can stimulate breast cells and increase vulnerability to mutation. Lifestyle patterns such as maintaining a healthy body weight, engaging in regular physical activity, and avoiding excessive alcohol consumption directly influence hormone regulation and reduce internal stress on breast tissue. Nutrition also plays an important role, as diets rich in antioxidants, fiber, and essential nutrients help support cellular repair mechanisms and reduce oxidative stress, which is one of the contributors to DNA damage. Processed foods high in saturated fats and refined sugars may contribute to inflammation, creating a biological environment where abnormal cell activity can develop more easily. Environmental awareness is another major component, as exposure to radiation, industrial chemicals, and long-term pollution can gradually affect cellular integrity. Limiting unnecessary exposure and being mindful of occupational risks helps reduce cumulative damage to breast cells over time, especially when combined with genetic predisposition factors. Regular medical screening and self-examination are essential preventive practices, allowing early identification of unusual changes before they progress into advanced stages. Techniques like mammography and ultrasound help detect microscopic abnormalities that are not physically noticeable, creating opportunities for intervention at the earliest possible stage of development. Genetic awareness also contributes to prevention strategies, especially for individuals with family history of breast cancer. Understanding inherited mutations such as BRCA gene alterations allows for personalized monitoring and proactive healthcare decisions that can significantly reduce risk through early surveillance and medical guidance. Stress management and mental well-being indirectly influence prevention by regulating hormonal fluctuations and supporting immune system efficiency. Chronic stress can alter biological responses in the body, potentially weakening natural defense mechanisms that identify and eliminate abnormal cells in their initial stages. Preventive awareness also includes educating individuals about subtle physical changes in breast tissue, such as lumps, texture changes, or skin alterations, which may signal early cellular transformation. Recognizing these signs encourages timely medical consultation, reducing the chances of progression into more invasive conditions. Collective awareness programs and health education initiatives help spread knowledge about risk reduction strategies, encouraging communities to adopt healthier lifestyles and routine checkups. This shared understanding builds a proactive approach where prevention becomes integrated into daily life choices rather than reactive treatment approaches after disease onset. Emerging advancements in medical technology are further enhancing prevention awareness through the use of artificial intelligence in imaging systems that can identify minute cellular abnormalities earlier than traditional methods. Digital health tracking tools also support individuals in monitoring body changes over time, creating patterns that help detect irregular developments before they escalate. Community health screening programs provide accessible opportunities for early assessment, especially in regions where advanced medical facilities may be limited. Continuous research into genetic markers and molecular pathways continues to expand understanding of how preventive strategies can be tailored for different risk profiles while integrating personalized monitoring systems that adapt to individual biological patterns. Influenced survival and recovery in breast cancer represents a complex biological and physiological transition phase where the body gradually shifts from active treatment response to long-term restoration and continuous monitoring. After primary interventions such as surgery, chemotherapy, radiation, or targeted therapy, the body begins repairing damaged tissues while adapting to the absence of malignant cellular activity. At the cellular level, recovery involves regeneration of healthy cells, stabilization of immune response, and gradual normalization of hormonal balance that may have been disrupted during treatment cycles. However, this stage is not simply the absence of disease activity, but a sustained state of medical observation, where residual microscopic cancer cells may still be tracked through imaging and biomarker analysis. Survivorship care includes structured follow-up programs that monitor physical recovery through periodic scans, blood tests, and clinical examinations designed to detect recurrence at the earliest possible stage. These systems are often extended over many years because recurrence risk varies depending on tumor biology, genetic mutations, and response to initial treatment. Alongside medical surveillance, physical recovery involves managing long-term side effects such as fatigue, reduced bone density, neuropathy, and tissue changes caused by radiation exposure or chemotherapy toxicity. Rehabilitation programs are often introduced to restore strength, mobility, and lymphatic circulation, especially when lymph node removal has disrupted fluid balance, leading to conditions such as lymphedema. Hormonal therapy, when prescribed, may continue for extended periods, influencing cellular activity by regulating estrogen pathways and reducing the likelihood of tumor reactivation. This prolonged biological control requires consistent monitoring of side effects including joint stiffness, metabolic changes, and emotional fluctuations. Nutritional rebuilding becomes essential, as the body demands higher levels of protein, vitamins, and antioxidants to support tissue repair, immune resilience, and energy restoration. Psychological adaptation forms another major layer of recovery, where emotional stability evolves alongside physical healing. Anxiety, fear of recurrence, body image changes, and shifts in self-identity often emerge during survivorship, requiring counseling, peer support systems, and mental health interventions. Cognitive adjustment also occurs as individuals transition from intensive treatment routines to long-term health monitoring behaviors that become part of daily life patterns. Immune system recalibration continues as white blood cell function stabilizes after aggressive therapies that may have temporarily weakened defense mechanisms. This restoration phase is essential for reducing infection risk and maintaining systemic balance. Gradual reintroduction of physical activity supports cardiovascular efficiency, muscle rebuilding, and metabolic regulation, while also improving emotional stability through neurochemical balance. Follow-up imaging such as mammography, ultrasound, and MRI remains central in tracking internal tissue behavior, often combined with molecular diagnostics that assess genetic expression linked to recurrence probability. These evolving diagnostic systems provide increasingly precise insights into microscopic cellular changes during post-treatment phases, allowing earlier intervention when irregular patterns emerge. Social reintegration becomes an additional dimension of recovery, as individuals return to professional roles, family responsibilities, and community interactions while adapting to changes in physical endurance and emotional perception. Fertility considerations may also arise depending on treatment exposure, requiring hormonal evaluation and reproductive counseling. Long-term risks such as cardiac toxicity from certain chemotherapies, bone weakening, and secondary malignancy potential require ongoing surveillance strategies. Modern survivorship care increasingly integrates digital health tracking, artificial intelligence-based monitoring systems, and personalized medicine approaches that analyze patient-specific biological data to predict risk patterns and optimize follow-up schedules. Survivorship clinics provide coordinated care models where oncology, nutrition, psychology, and rehabilitation specialists collaborate to maintain long-term stability. While continuous data-driven assessments refine preventive strategies and adaptive treatment pathways, as recovery progresses into sustained monitoring and evolving biological equilibrium, as ongoing surveillance continues to integrate with emerging predictive health technologies and individualized care frameworks shaping future long-term management approaches.